My name is Johnny Sandoval. I talk about therapy clearance of amyloid by antibodies to serum amyloid peak component. Definition: amyloid is an abnormal protein produced by the bone marrow which is insoluble, resistant to proteolysis, and tend to accumulate in many tissues, causing a disease called amyloidosis that can commonly affect the heart, kidneys, uh, liver, spleen, nervous system, and digestive system, being related to chronic disease such as Alzheimer and having no cure. But there are many experimental treatments, such as the article in case, which use antibodies to clear amyloid deposits.
So amyloid is a sticky protein that has this tendency to clump together, and it's produced from a large precursor protein, the amyloid precursor protein. We're trying to understand how it's produced, how it then clumps together, and how those clumps of protein interact with the surface of our nerve cells and then cause the problems that we see in people who have Alzheimer's disease. If we could understand how the amyloid is produced, how it's clumping together, how it's interacting with the nerve cells, then there's the potential there to disrupt those processes as potential treatments for the disease. And so a lot of what we do is just trying to understand the basic processes that are going on in the brain and whether we can then exploit any of those as a potential therapeutic target for the future development of drugs.
Application in medicine. The article centers on the fact that amyloid has non-fibrillar normal plasma proteins, serum amyloid, a P component, which can be targeted by specific antibodies activating complement and clearing the deposits, but without damaging other locations by the CPHPC drug with which can deplete the plasma SAP. Results: throughout the infusion of the fully humanized monoclonal anti-SAP antibody after the mediated depletion, many patients had decreased liver stiffness, improvements in liver function, and reduction in kidney and lymph node amyloid load, concluding that safely triggered and clearance of amyloid deposits from the liver and some other tissues.
So, amyloid plaques are, I would say, clumps of protein that are in the brain in the extracellular space, meaning that they are outside of any cells. They're just situated between neurons within the brain. And these are composed of multiple amyloid beta peptides. So the A beta peptide is a very short 40 or 42 amino acid long protein that when you get multiple amyloid beta peptides coming together, they form an insoluble piece of protein called an amyloid plaque. And so this is one of the three pathological markers that we know cause Alzheimer's disease.
Pros and cons. Pros: reduction of amyloid-based disease and major compression over associated disease such as Alzheimer. Cons: the treatment was effective in the visceral amyloid deposits, but not in heavily amyloid organs. Therefore, neither in massive amyloid loads.
Today we had a very interesting sessions that I shared about amyloid and tau. This is a real field that new data is coming every day. The possibility to image amyloid in the brain in patients has now been possible for some years and has provided us a lot of information. And now, just for a few years, we have also started to image tau. And that gives a possibility to understand the relationship between these two considered as two very important histopathological features of Alzheimer's disease. The discussion is what comes first and what drives the disease, and it seems to be quite complex because we have here had presentation both of tau in normal subjects as well as the possibility of tau in subjects who are carrying mutation and still not have developed any symptoms, as well as those who have symptoms. So I think this conference has given us a lot of new information, but it also gives us the feeling that we have to continue and do more research. And especially for tau, we still have quite few what we call tracers for positron emission tomography, and tau is very complex, different forms, so perhaps this needs much more research than the amyloid scans, and which could reach a clinical application quite quickly. But this will be very important for also evaluation of new drugs in Alzheimer's disease.
Use applic in Ecuador. Amyloidosis is rare disease affecting around 3 or 4 million every year, and that's no difference in Ecuador. For example, in the Statistics of Hospital Researches 2018 by the INEC, 26 people was described with amyloidosis or in a study of cutaneous amyloidosis in the hospital Luis Bernaza. Out of 7,200 people has cutaneous amyloidosis, so we can conclude that the disease is present but have a very low prevalence. Conclusion: we can conclude that amyloidosis is a rare disease affecting around 3.5 people per million, caused by the accumulation of an abnormal protein called amyloid, and causing damage in many organs and systems, being related to chronic disease like Alzheimer, but is being studied and multiple treatments are emerging as the use of antibodies, CPHPC, and showing great results. Thank you.